Okay, so we're going to be taking a video. Are you okay with that?
Yep.
Alright, here we go.
Okay.
Good, so
Hi, I'm Pamela Lyons.
we're just doing some Pamela Lyons. Here we go. She's happy with the videos. What we're doing is we're doing the work on Pamela. You couldn't walk when you came in the first day.
Correct. I couldn't walk in November. I couldn't walk. I had a cane, and I was like that for 2.5 years. Came to see Dr. Austin. See that sign up there?
We did it.
Expect a miracle? That is true.
We did it.
Come and see him.
We did a Trigenics non-surgical operation on you, and you walked out.
And I walked out a year.
Yeah. We worked. This is all the findings we had in the exam with her here. It's where the imbalance in the muscles were very, very severe. The gluteus medius, minimus, hip abductors, medial rotators were just shut down completely, as was the quadratus lumborum. Lateral hip rotators were completely contracted in spasm, as were the opposing medial rotators, and then we had the iliacus was very, 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 very weak. And then on the same side of involvement, the adductors were contracted short, and we had a bilateral weakness of TFL, which indicated a nerve root compression at L5S1. And these were all the intervertebral fixations that we had. So when we did the non-surgical operation, the Trigenics non-surgical operation on her, then we were able to literally get her walking from not being able to walk and having to use a cane. We'll find those videos for you, to walking out perfectly.
Correct.
Perfectly,
Yep.
without pain.
Perfectly, without pain.
How many different doctors and therapists have you seen?
I have dozens. I have a file that is like this big. That I went to specialists and doctors and doctors and doctors that couldn't figure out what was wrong with me. And then finally,
what type of doctors have you seen?
I've seen a hip specialist. I've seen a back specialist. I've done like
physio?
like physio. I've been like to chiro. I've been to acupuncture. 4 different therapists, and they couldn't fix me. They're like, well, it just seemed like it was getting worse when I would go to see them.
You were basically crying in pain.
Correct, yeah. And then I come to see Dr. Austin, and he fixed me.
Trigenics.
Trigenics!
Okay, so what we're doing here now is we're just following the chart here. So right now I'm going to work on the gluteus minimus, and we're going to do a little bit of a trigenic strengthening procedure on that. So she's going to come in this way as I'm resisting that movement, breathing, and go ahead, go, and breathing, and go, and breathing, and go, and breathing, and go. Good, very good. And yeah, there's 2 different Trigenics guns that we have here, depending upon what condition we're using, multi-probe and the uni-probe here, although this can also be a bi-probe. And all of them are designed to increase tissue distortion, mechanoreceptor stimulation maximally. And of course, we also use the vibrocursor as well. Okay, which we're going to do right now. I'm going to do this on the piriformis and lateral rotators. What you're going to do is you're going to come in. I'm going to resist that motion. Breathing in and breathing out. Go. Pull hard on this one. And relax. Breathing and pulling. Pull hard, pull hard. Just doing a distortion transverse to the fibers here with the arthros and with the vibrocursor. And relax it. There we go. Very good. Excellent. That's good. And then we're going to come in on the QL here. So you're going to come in this way slowly as you breathe out, breathing, and go. Good. Breathing, and go. Breathing, and go. Breathing, and go. That's it. Perfect. Very good. Very good. Very good. Got a little bit more on that QL I'm going to do with my hand. I'm going to do that with my hand here. You just feel a little bit here still, right,
Yeah.
Pamela? Breathing? Sometimes you've also got to use the hands on this. Good. Breathing. Go. Breathing. Breathing. Good. Excellent. I've still got to go in a little bit. I think I'm going to use the other one on this. So it's more of a broad contact here. Breathing. And go. Breathing. And go. Good. Excellent. Okay. Very nice. Just doing a little bit of tune-up work here on her. Mainly, spine had rotated to the right in the lower spine, lower lumbar. Line your side facing me. So I'm going to do a little osteopathic chiropractic manipulation here. Maybe a combination of both, considering I'm just letting it go. Letting it relax. That's it. That moved nicely. On your back. Very good. Stay on the back, yeah. That's good. Now I'm going to follow through the most painful procedure we did on her was the Trigenics TS Psoas, ilio-psoas procedure, which she pretty much broke down in tears over that one, didn't you?
Yeah,
that
I sure
first
did,
day.
yeah.
But it sure helped her out. It sure fixed her. First I'm going to use my hand just a little bit on it. Yeah. So you're going to turn this way as you breathe out. Just kind of resist that breathing. And go lightly, 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 lightly. Come down, come down, come down, come down, come down. And relax. And breathing. And light, light, light. So I'm doing a twisting distortion on the mid area of iliacus here to distort those mechanoreceptors maximally to cause basically an increase in the inhibition of the muscle. So we want to super inhibit the muscle to cause the brain and central nervous system to want to recruit more motor units and increase the synchronization of firing of the motor units as well as the speed of firing of those motor units, which will give it a general overall increase in strength. Breathing.
Ow. Okay,
What,
it just was twisted
your
wrong.
ankle?
No,
Okay.
my hip.
Your hip. Breathing.
Yeah.
And turn. Good. Breathing. And turn. Good. I'm going to use this one as well. Because then I'm going to get a little bit of a broader contact on this. Coming in all the way. Let's lift. Breathing. And go.
Oh.
Breathing. And go. Good. Yeah, that one was a little sensitive.
I think it's because of my endometriosis.
Because of your... Really?
Endometriosis.
Okay, now let's line your side facing... Oh, now we're going to go on the other side, sorry.
Yeah.
Oh, no. Forgot one thing.
Alright.
Let's do that. Here we go. Just going to change the head for a second on this. And then we're going to just do that one more.
Like that, like there?
Yep.
Okay.
So you're going to turn in.
Okay.
Breathing. And go ahead. And relax it. Let it drop. Breathing. And go. And let it go. Breathing. And go. And relax. Let it drop. Good. Perfect. Very nice. Beautiful. You should be glad we don't use this one on you.
What's that thing?
You don't want to know. Okay. I think you're all done.
Right.
You're all done. Oh, on your side facing me.
Yeah, is that one?
You just got to do this one, the
Yeah.
high one, and you're set.
Yeah.
That was really good today. No, this one is...
Ugh.
No, that one's pretty good. On your back. Let me just check. Right side. There we go. And breathing. And push with your knee lightly. And relax. And again. Go ahead. And relax. Beautiful. Okay, off you get. Let's try that out now. Stand up. Good.
Oh, that feels better. Thank you.
Good.
I needed you.
Good. You're all done.